All right, everybody, how are you? This is Koonce, the super producer with WDHR Radio Digital Broadcasting Network. We are getting ready to do it again, y'all. The Vanguard Fitness Hour. This is show number 10. We are getting ready for season 2, so we're going to end the first season, with some very, very, very hot stuff. For instance, Mr. Mario is going to be talking to Nurse Dena Mayes on the show topic on the front lines of the pandemic. The Vanguard Comment, the 5 F's that will keep you fit. Fitness tip of the week, De-Compund the problem. So get ready, y'all. Get ready to bring him on, Mr. Mario Koonce, the fitness guru. Go on, do your thing, Mario.
Super producer, thank you once again. Always ready with the great introductions. Thank you for summarizing everything that we have got ready for ourselves to cover. Information that we're going to share with that audience. I'm wearing a mask just for now, just to reinforce the point that it is important to mask up. Although we have these vaccines out here, it's still important to make sure that we take the precautions necessary to keep not just ourselves safe, but others around us as well. So having said that, I'm going to go ahead and remove my mask and get ready for our broadcast. So welcome. It is Friday, February 19th. As super producer Koonce mentioned, this is show number 10. We've had a blast these first 10 episodes and are really looking forward to season number 2. So we're glad that you're along with us for this journey, and it's going to be even better during the second half with this upcoming season number 2. So with that being said, as always, I've got 20 pounds of fitness information, motivation, and inspiration to stuff into a 10-pound bag. So it's time to get started. First topic. What's new with the fitness guru? I've got several topics that I want to share with you all today. First, and super producer, I did not mention this to you before, but I wanted to live and on air. I wanted to thank you for the wonderful job that you and Kim both did in producing the WDTR page on the WDHR radio site. I had an opportunity to look at it for the first time last night. It is fantastic. That is, so what happens, I just want to share with the audience, if you go on to the WDHR radio link, and I advise all of you to go on, not just to go and visit it, but to lock it in, share it as a bookmark, whatever you got to do, because there's great content, great music. It's a fabulous site. So make sure you do that first of all. Once you're on WDHR's radio site, you can click the tab that links you to WDTR or Talk Radio. That is the area where you're going to see all my past shows. You're going to see content that I'm going to share. You're going to see all kinds of fitness information, all the topics of the day that reinforce what we do here on the show, which is to provide you with all the tools, tips, and strategies necessary to make sure that you are living your most optimal lifestyle in terms of health, wellness, and overall fitness. So thank you very much, super producer. I really appreciate that. That WDTR page is looking great, and I'm looking forward to adding more and more content as time passes.
Oh, no problem. You're much welcome. Much welcome.
All right. Next up, last week I had an opportunity to present some information to the Advocate South Suburban Hospital. They have a Department of Diabetes and Endocrinology, and I was invited as a guest to come on and talk about the importance of diet and exercise, sleep, nutrition, in terms of reinforcing the strategies that individuals that are either pre-diabetic or diabetic need to be enacting in their everyday lives so that they can be as healthy as possible. So I had a great opportunity to do that, present to the class, and it looks like that's going to be an ongoing thing. I'm going to make sure I keep the audience updated as time progresses, but I'm looking forward to a partnership with Advocate South Suburban Hospital. I will be posting a link to the video that I produced that I was with when I was with the class. So you have all that content available to you at that time. So very exciting opportunity, and really looking forward to working with individuals that are dealing with that disease or are at risk of developing the disease. Next up, Vanguard Exercise Management has been celebrating Black History Month all month. So if you happen to go on to either of my social media sites, and the first one would be the Vanguard Exercise Management Facebook page. The second would be the Vanguard MGT, VANGUARD, followed by the number 1 Facebook page. every day I've been posting up a different individual and celebrating their accomplishments in health, wellness, fitness, and these are all prominent African Americans that have made an impact within that field. So every day there's a different link. I've got a pick, biographical breakdown. So it's giving you a lot of content about a lot of individuals that you may not be familiar with. So some of these names might be obscure. It's not the traditional Black history individuals that you typically hear about, Dr. King and W.E.B. Du Bois and that sort of thing. Great individuals, but I've chosen to focus on individuals that have had an impact on health, wellness, and fitness. So there's athletes on there, there's medical professionals on there, there are pioneers in the fitness space that are listed on there. So I encourage you to go on, celebrate Black History Month with me all month long, and I'll have another post going up today. So looking forward to continuing to share that information throughout the month of February. Feedback from last week's guest appearance. I had many of you that watched the program, I had Miss Ingrid Isaacs on there as my guest. And we went through a lot of different exercises. She talked about her background. We both shared our experiences as competitive bodybuilders. And the answer is yes. She will be returning as a guest, and we'll be talking about some other features as well. So look for that in season 2. Excited about that. Next up, March 1st, 2021. I like to share things that I'm going to be doing or I intend to take part of with the audience. So beginning next month and Monday, March 1st is going to be the start of my own intermittent fasting implementation. So with intermittent fasting, there's several different types. Basically, the type that I'm going to be using is a 12-8 pattern. So during that time, basically all your meals are consumed within an 8-hour window of time. So that's what I'm going to be doing. So basically, it's probably the easiest type of intermittent fasting to follow along with. Basically, it boils down to you skipping breakfast. So my time slots are going to be between noon and 8 p.m. So basically, no food after that time. Now, you can consume certain beverages, water or green tea, black tea, stuff like that. But that's the process I'm going to be following through the month of March. I encourage all of you to participate with me. If you are interested in receiving information about how to utilize that program, I'd be happy to shoot you that information. Just drop me off an email, Vanguard mgt@yahoo.com. I'll send you all the information. And again, my contact info is going to be posted up at the end of the show by super producer Koonce regardless. So I'll be happy to hear from you. And if you want to take that journey along with me, please feel free to do so. You're more than welcome. The more the merrier. We're all going to get healthier and even more fit together. Last up with what's new with the fitness guru, sponsorship status. I've had quite a few people ask why I don't have certain types of products or services that I promote on the show. And quite frankly, it's because there has to be a certain type of product or service that I support. First of all, if it's something that I don't agree with, that doesn't fall in line with the message that we're trying to promote to the audience, it's not going to be something that's promoted on the show. So although, hats off to small restaurant owners, but if you're serving, greasy foods that are high in cholesterol and sodium and sugars, it's not going to be something that's going to be promoted on the show. If you're a liquor store, for example, not going to be something that's promoted on the show. So there are certain types of products, services that I encourage individuals to use, but if it's detrimental to the overall message of the Vanguard Fitness Hour, you're not going to see it on the show. So I wanted to share that with the audience. I'm sure everyone will understand that. If nothing else, an individual has to be able to offer credible information. And if you lack credibility, nobody's going to listen to this program anyway. So that's the underlying message behind that. So with that, I'm going to move on. I'm sorry, any feedback from you, super producer? I always like to make sure you get to chime in a little bit.
Nope. you pretty much said it. You pretty much said everything. I mean, you can't get no better than that. I mean, we're not discriminating towards, liquor stores or people or fast food joints. If that's the case, then of course, you advertise with, WDHR digital radio broadcasting. You advertise with the station itself. But as far
That's
as
right.
for what the fitness guru is doing, I mean, no, definitely everything has to be and will be based on, as far as any products or services advertising that we promote is for his brand will be promoted based on fitness, health, and wellness. So that's just something that, he didn't say it, but that's just something that I put and said it's not going to happen, basically.
Right. Yeah, the two just don't fit. So
Right,
I
they
wanted
just
to
don't
explain
fit.
that because I was getting quite a bit of feedback on that. So I want to clarify my position on that.
Yeah, no,
All
you did a
right.
great job.
Thank you very much. I appreciate it. Moving on. New segment, and I mentioned the fact that we're going to start to implement this next week, and that is the Vanguard Fitness Word of the Week. So basically, what I'm doing is I'm taking a term, a phrase that is based in fitness, nutrition, health, wellness, that sort of thing, and sharing it with the audience because I noticed that sometimes I'll use terms and I'll get questions. Well, what did that mean, or how does that apply to what I'm doing here in the gym and that sort of thing. So the Vanguard Fitness Word of the Week is really going to expand on and elaborate a lot of that. So the first word that I selected for this inaugural segment is hypertrophy. So what is hypertrophy? You'll hear that a lot of times when individuals are talking about working out and building muscle and that sort of thing. Hypertrophy basically refers to an increase in muscle size as a result of exercise. So if you're looking to work out, you're looking to tone or improve muscle size, muscle definition, that sort of thing. Lifting weights is the most effective way and common way to increase hypertrophy. So as you exercise, you work out, you're doing bicep curls, that sort of thing. That soreness that you feel within the muscle group that you're targeting is basically the buildup of lactic acid, right? So that's what gives you that burning, like, soreness, feel the burn, that sort of thing. You're tearing down that muscle. So as you rest and recuperate, and I do advocate making sure that you allow a rest period in between workouts, specifically with certain muscle groups, you want to allow time for that muscle to build back up. So as you work out, you're basically tearing down the muscle. Your rest and recuperation period allows the muscle time to grow back, and it repairs itself, and it starts to increase in size. It builds back up better than ever is primarily the kind of term that you're looking at when you're talking about muscular hypertrophy. So hypertrophy is the word that I want to share with you today. So that is the Vanguard Fitness Word of the Week. Next up is our Vanguard question of the week, or social media question of the week. And I encourage all the feedback that we can get on this subject. I love that. I'm able to address and interact with the audience more. So you can utilize either of the social media pages, and that would be the Vanguard Exercise Management Facebook page. Just type in Vanguard MGT. It'll start to come up on its own. Or you can even respond through Instagram if you like. Or if you prefer to shoot an email to me, you can do that as well. But the Vanguard social media question of the week is, do you intend to take the vaccine? And I don't know if you're talking about Johnson & Johnson, Moderna, whatever the case might be. Do you have intentions on receiving the vaccine? There's a lot of question about the vaccination. A lot of people are very ambivalent about it, or just downright opposed to it. Whereas some people are, jumping at the chance. So I'm hearing a lot of back and forth with that. So that kind of that was the impetus for me presenting this question to the audience. So I'm really curious to get your feedback. Do you intend to take the vaccination? So again, shoot your responses back to me. I'd love to hear that. I'm going to do a tally, a poll, and then report back when we come back on our next show, so we can get some percentages in terms of individuals that are looking to do that, or they're opposed to it and have no intention of taking the vaccine. Next up, Vanguard Commentary. So this is another new segment that I wanted to share with you. There are certain factors that individuals engage in that are detrimental to what it is that they're trying to do in terms of becoming more fit, reaching their optimal levels of health and wellness, achieving a certain weight loss goal, whatever the case might be. And a lot of these times, these factors are things that are unintentional. We don't even know that we're sabotaging ourselves when we're setting out on this goal to achieve some fitness level. So that's the resource. That's the reason that I wanted to make sure that I shared this particular topic. So the Vanguard Commentary are basically the 5 F's that will keep you unfit. Now, initially, I was playing around with that title, the 5 F's that'll keep you fat. I didn't like that. So the 5 F's that'll keep you unfit. The first one is family. So what do I mean by that? My family's keeping me fat. In some cases, that might be the case. The best thing that you can do for a family member or an unfit family member is to not become one of them. And what do I mean by that? I can't tell you how many clients I've had that I've worked with that have, they're dead set on this journey, and they're going to lose weight, and they're going to start to eat better, and they're going to exercise more, and they're sabotaged by the individual that's closest to them. So keep in mind, let's use, for example, a woman that is looking to, become healthier and improve her eating habits and get healthier and that sort of thing. And she's got a husband that comes in every other night with a bucket of KFC. All right. If KFC is something that she likes, that's going to be a hindrance to her. I mean, that's something that's put in front of her that's really that's even more of a challenge now. So in addition to having all these new goals that she set for herself, she has to fight against the battle of, well, I got my favorite food in front of me. So what does that do to an individual's mindset? Do they give into that struggle? Does that cause conflict in the relationship? So you want to make sure that you're surrounding yourself with individuals that are going to support you on this journey. If not, at least get out of the way. Don't hinder me. And ideally, you want to have someone that's going to support you at best. So, even though maybe the husband's doesn't have the same goals that the wife does, I'm going to be kind enough. I'm going to be respectful enough to understand that you've got a goal that you're trying to achieve, and I'm not going to block you from doing so. So, I'm not going to bring that, if I'm going to have KFC or whatever the case might be, or a burger or a pizza, I'm going to do it out of the house. Okay. Ideally, you want to have both partners working together. But if that can't be accomplished, at least support the person in the household. So you want to make sure that you're careful when it comes to family members. Get them on board. Explain to them what it is that you're trying to achieve. Get them to support you if possible. And that's going to make your journey all the more successful. So that's the first one. The second one are friends. Okay. So to put it bluntly, if you've got four, and excuse the term, if you got 4 fat friends, you're probably on your way to becoming number 5. And what do I mean by that? What do friends typically do? They share the same, they travel in the same social circles. They do the same kind of activities. They go to the same places. So if I'm the one in the group that maybe is trying to get fit or at least trying to maintain, and I'm always surrounded by, I've got my close friends around me, and we're always going out for drinks or for food, or we're being sedentary, you're going to start to adapt some of those lifestyle habits, and that's going to be really detrimental. That's going to get in the way of what you're trying to do. So you want to, in some cases, quite frankly, you have to cut people off. At best, you want to at least get them on board and have them understand what it is that you're trying to do. If you're not helping me, you're probably hurting me. So think about that when you're choosing your friends and making determinations into what types of activities I'm going to engage with my friends. So that's the second F. The third one are finances. And, finances, in some cases, not a lot you can do about it, but there are some cogent points that go along with finances and obesity. Obesity is very rampant within communities where education is low and poverty is high. Okay, that's very factual. You can go on and see the statistics that support that. And why is that? There's a ton of different reasons. Food deserts tend to be prevalent in communities where individuals have low income rates. Your trails, your playgrounds, parks, and that sort of thing. And a lot of times poverty and crime go hand in hand. So a lot of those, even if the areas are available, they might be considered dangerous. So you don't want your child to go out and play in the park, even though, they may want to, or you may want them to, it might not be safe. So that outlet for that exercise might not be available. Another one is, a lot of times individuals that are dealing with poverty tend to be uninsured. So that lack of access to healthcare might be another roadblock. Economic insecurity, what does that lead to? Stress. What does stress lead to in the body? The buildup of cortisol, which is the negative hormone that builds up in the body. And when an individual is under stress, a lot of times they respond by, making poor health choices. Maybe they eat the types of foods that they should not be eating or wouldn't ordinarily eat. So that's another factor, finances. Number 4, foods. Processed foods, things like that are high in fat and sodium and sugars and preservatives, they tend to last longer. So a lot of times that's like the go-to item. So I can buy something out of the frozen section, put it in the freezer at home. It's going to keep for a long time. It may be that I'm making poor decisions when it comes to the types of foods that I'm putting into my body. Everyone knows that, well, maybe not everyone, but the majority of people know that if you eat bad foods, you're going to get bad results. You're going to gain weight. You're going to be sluggish. You're not going to have the energy that you need to get through your day and that sort of thing. Many times individuals don't take the steps necessary to make the changes that are required in order to become healthier. So the foods that you put into your body, that's the fourth F that's going to keep you to be unfit. And then the final F, your feelings. And what do I mean about feelings and how that can relate to an individual being unfit? You need to examine your relationship with food. Are you a stress eater? Do you eat because, not just because you're hungry or because it's dinner time or lunchtime? A lot of times people eat because they're bored, because they're unhappy, because they are happy. Foods and meals, basically the way that we're even raised in this country is food is the centerpiece of special occasions. What do you think about when you think about a birthday party, right? There's cake, there's ice cream. What do you think about when an individual is celebrating an anniversary party or a wedding or a graduation? Food tends to be the centerpiece of that. So we start to equate that with our own emotions. I'm happy, so I'm going to get something to eat. Or I'm sad, I'm feeling, I just broke up with my significant other, or, the cat died, whatever the case might be. So, I'm going to cover that, I'm going to mask that hurt, that pain with a meal, with a beverage that's loaded in sugar, whatever the case might be. So you have to ask yourself, am I eating to satisfy hunger or am I eating to satisfy my feelings? So once you come up with an answer to that, then you're in a better position to make better choices. So those are the 5 F's that will keep you unfit, and I want to share that with the audience. So thank you very much for that opportunity. Next up is our article and our fitness news of the week. And I've picked up an article now for the sake of time because we do have something special today. Normally we do a couple of different articles. I'm just going to focus on one that just came out in the Chicago Tribune the other day. And it was entitled COVID, a Killer for the Obese. Now, I'm not going to go through the entire article. I'm going to highlight some of the content that I found to be very interesting as part of this article. So basically, COVID, a killer for the obese. It's like pouring gasoline on top of a fire. That was the headline, and that attracted me when I saw that. So what it focuses on is the efforts of Reverend Robert Beekman, who lost just a great deal of weight, and he is taking steps to make sure that not just his congregation, but the surrounding community are doing things to keep the community healthier, more fit, make better nutrition choices, those sorts of things. So I'm going to go through some of the topics in here. Chicago churches, particularly in the Black community, have targeted obesity, which contributes to heart disease, diabetes, and high blood pressure, among other ailments, and poses a higher risk of lethal complications from COVID-19. Now, we've been hearing this quite a bit when individuals are afflicted with COVID-19, the coronavirus. Comorbidities come into play, things like diabetes and heart disease and liver disease and respiratory illnesses and that sort of thing. So really reinforcing this. The image that you see right there on the screen is the Reverend Robert Beekman. That's kind of his before picture. He very heavy, and I'm going to get into that weight a little bit and the weight loss that followed it. When the Reverend Robert Beekman was diagnosed with COVID-19 last month, and this was just in January, he couldn't help but think what would have happened had he still weighed more than 360 pounds. That image that was just on the screen was the Reverend at 360 plus. Realizing how his condition just 4 years ago would have hurt his ability to fight the virus and potentially cost him his life. So he's really reflecting on, what could have been had I been as heavy as I was before and contracted the virus during this pandemic. Now, the question becomes, what did he do to lose all this weight? 360 pounds, and what does he weigh now? After a 2017 surgery, a change in diet, and a commitment to run 5 miles every other day, he now keeps his weight at around 190 pounds or less. Now, that's a significant weight loss. We're talking about 170 pounds. The key factor in here, and I'm not a big proponent of it unless it's medically required, but he underwent some type of, it mentions a surgical procedure. Now, there's two types of surgical procedures when it comes to weight loss like that, and there's restrictive and there's malabsorptive. So with malabsorptive surgical procedures, the stomach is reduced, and at the same time, a section of the digestive tract is removed, and that inhibits the body's ability to absorb calories. With restrictive, now we're talking about lap band surgery, that sort of thing. The stomach is reduced in size. So I don't know which one of these procedures he undertook, but he went through some type of surgical procedure to help with the weight loss. I'm a bigger fan of doing it, over the more gradual process. But if there are medical issues involved, then maybe that's the right step. But that's what the Reverend went through. It mentions that heart disease, and this is no secret, is the #1 cause of death among Black men in the United States. And obesity is a big contributor to that. It mentions the pandemic exposed another deadly threat from obesity, which is a higher risk of complications from death from COVID-19. Obesity can triple the risk of being hospitalized with COVID-19. So 3 times the risk if you are above a certain weight limit or above a certain BMI or body mass index. So that's a real roadblock or hindrance to an individual's ability to fight this disease. Cook County Medical Examiner records list obesity as a contributing factor or cause for 760 deaths through January 10th, beginning at the start of the year, or about 1 in 11 of the more than 8,500 deaths during that period. The data also revealed that even with younger individuals who have died, and a lot of times we hear, well, if you're younger, you're not going to be as susceptible to the disease, you're better off able to ward against it and that sort of thing. But the data found that individuals that are under 40 accounted for just 2.5% of COVID deaths. However, among that group, almost 40% of the deaths recorded for that group had obesity as a contributing cause of death. So obesity, being overweight, was an underlying reason that these individuals actually lost their lives. Blacks make up about 23% of the county population here in Cook County. Yet they accounted for 38% of the COVID deaths, with obesity being a contributing factor. And these are records that were investigated and reviewed and the data shared. So what are individuals like Reverend Beekman doing to fight this off, to get communities healthier, to get individuals to make better choices? Well, he's engaged in a process where, as Lent season is approaching, he partnered with another pastor. This is the Reverend Otis Moss III, who's the senior pastor at Trinity United Church on the south side of Chicago. So basically what he does, he urges his 7,500 member congregation to participate in honor of this holy period to healthy living. This includes weekly adherence to nutritional eating. He's encouraging them to change their eating habits, all right? Get more active, do all the basics. It's part and parcel of our mission and our vision, Reverend Moss said. One of the things that we work very hard on is not only healthy choices, but diet, exercise, spiritual, and emotional state of health. So this is an all-encompassing venture that he's looking to engage his members in. During Lent season just 2 years ago in 2019, more than 40 members of Trinity United, encouraged by Moss, who was the Reverend, agreed to eat only a plant-based diet while a team of doctors monitored them. Now, I don't know if you caught that, but this really stood out for me. Not only did I highlight it, I underlined it as well. He's got a 7,500 member congregation. How many members did I say participated in this study, effort? 40. So that just goes to show you how resistant individuals can be to making changes that are necessary to just improve their lives. This is the battle that the Reverend has to fight when he's trying to improve the health of not just his congregation, but the surrounding community as well. 7,500 members, 40 said, yes, I'm willing to engage in these healthy practices. So there's a lot of work to be done. Imagine it's like pouring gasoline on top of a fire when you have COVID. And this was reported by Dr. Terry Mason, who used to be the Cook County Chief medical officer. It creates these horrific situations in our body, he stated. That's why most of these people who have died from COVID, most of them have these underlying issues. If we really want to get to the core of the problem, we have to change the way we eat, and that can't be stressed more vehemently. Williams and Mason, they're both vegans. They promote the merits of a healthy eating plant-based diet and avoiding processed sugars and meals and food items that are laced in sodium and that sort of thing. Preventive care. Now, this is where we really fall in line with and agree with their approach. That's where we're aligned. They state that preventative care, including exercise and healthy eating, is a better approach than maintenance through medicines. And I'm a big proponent of that. I'd rather see an individual do what it takes to prevent the disease rather than get the disease and then have to be treated. In a lot of cases, that's through medication. And with that, you normally take on a lot of contraindications because, you're taking this drug, and a lot of times, if it's multiple prescriptions, you have to take other ones to offset the effects of the initial prescription. So if you can do that naturally, by taking steps, getting more active and eating right and getting enough sleep and managing stress, you're in a much better position than actually contracting a disease and try to deal with it and clean it up from there. Because of its impact already stressed organs in the body of obese people, COVID-19 is just the latest bad outcome for poor eating habits. So the story goes on to mention that. And there are some factors that are in here that, a lot of times you don't even think about. So, I'm obese. Why is it that we keep hearing that, people that tend to be heavier are going to be more susceptible to different diseases? And the negative effects of contracting COVID-19. Even patients who are overweight just enough to be at the low end of being considered obese can face complications from COVID-19. An obesity member of New York University stated this: the more obese a patient is, even procedures such as basic procedures, things like medical imaging and placement of breathing tubes, intubation, can be a hindrance, can be difficult, right? And we're talking about CT scans and MRIs and MRAs and mammographies and that sort of thing. Even those can be more challenging for individuals that are obese. So there's a lot of data that supports making sure that we're managing our weight, particularly in the midst of a pandemic. The pandemic exposed discrimination in the U.S. health system. And we're seeing that not just with the efforts that are being made to manage the disease, but we're also seeing that with the vaccine rollout. So this is very common and something that we are struggling with and have to deal with as we go on. So they enacted a couple of initiatives for the south and west sides of the city. Grocery stores, more access to healthy foods, the prevalence of more healthcare facilities within different communities to kind of manage through this virus and making sure that individuals have all the avenues that are available to them when it comes to managing through a pandemic. So I thought this story was very interesting. I salute Reverend Beekman in his efforts. In fact, I may even be reaching out to him to see if we can maybe get him on as a guest for a future show. So that was what I wanted to share with you in terms of our article of the day and our fitness news of the week. So with that being said, I mentioned that we had something special today. Today I have a very special guest that's going to be joining me, and this is Nurse Mayes. So I listed on the promotional material, the topic of our appearance today was going to be Meet Nurse Dena Mayes on the front lines of a pandemic. And this is an individual that I've gotten to know, and very, very extensive information. She's got a very highlighted career. She's done some amazing things in the work in the medical field. She began her career in 1989 as a medical surgical nurse. Later, she transitioned to critical care, including telemetry, step down, and ICU and ICU intensive care units. In the late 90s, she was recruited from ICU to home health care and developed a passion for it. More recently, with the prevalence of managed care organizations, also known as MCOs, Nurse Mayes became involved with insurance case management until the desperate need for highly skilled ICU nurses due to the coronavirus pandemic drove her to become a soldier in the war against COVID-19. So with that being said, I give you Miss Dena Mayes, registered nurse. She's going to be joining us today. Come on over.
Oh, that was so good. Oh, now that was a good introduction.
Well, I'm glad you liked the introduction. You were
I did.
more than worthy. So,
I did.
all right. So, have with me Nurse Mayes. Welcome to the show, the Vanguard Fitness Hour.
Thank you.
And you all see that her being a nurse, she's masked up right now. Again, both been tested. Closed environment. No one else is in the studio right now, so she's free to remove her mask so you can hear her better. But we want to make sure that we are pushing the message that it's very important to continue to take the safety measures that we've been following along, hopefully up to this point. Make sure you're masking up, make sure you're washing hands, sanitizing yourself, social distancing, all the things that go to supporting a healthy environment. So, Nurse Mayes, welcome to the program.
Thank you.
All right. So I'm going to jump right into it. I want you to tell us a little bit about yourself. Now, you became a nurse, a registered nurse in 1989. That's a 32-year career.
Oh, yes.
So I got to ask, so what initially got you to make that decision that, I want to be in healthcare and become a registered nurse?
Well, growing up under a mom that was a single parent, all I saw was nursing. My mom did nursing. So I remember as a child actually attending school with her. As a child, like I want to say as young as maybe 4. She shares stories about how she took me to lectures and she would give me a pad, a spiral notebook, and she kept this notebook for a long time. And it was just little bitty circles with me sitting there taking notes during her lecture. And that's all I knew. So I never wanted to be anything else except a nurse.
Okay. So that influence was there really young. So your mother, being a nurse or going through that process during that early age, that really stuck with you, even at that young age.
Yes.
You knew you wanted to work with individuals.
Yes, because she took me to school with her.
Okay, gotcha. So let me ask you this. So you kind of took to it naturally. You're with your mom, you see her, what she's experiencing. You're there experiencing a lot of it with her. As you got older, was there any pressure to become a nurse? I mean, did you feel like, I have to follow my mom's footsteps?
No. I knew right away what I wanted to do. So there was no pressure at all. I don't even think she ever asked me what I wanted to do. It was just, I knew that this was what I wanted to do. So there was no pressure at all.
Okay, so it was very natural for you.
Yeah.
Over the course of 32 years, and I mean, a lot of people don't stay in a position 32 months, but you've gone through this. You've been a registered nurse for 32 years. You've seen and done, I mean, just a wealth of experience.
Yeah.
So I got to ask, during that time, what are some of the most significant changes that you've seen within the nursing profession, the medical industry during that amount of time? I know that's a lot to cover and a lot to think about, but what are some things that have really impacted you that you've seen that have occurred, during your time as a nurse?
One of the biggest impacts of nursing is social media. Social media has really changed the healthcare because there's all this information that's out there right at people's fingertips.
Okay.
So a lot of times you get it's a double-edged sword. Sometimes you have patients that are misinformed.
Right.
And then you can have patients that are informed.
Okay.
So a lot of times it's good and bad because there's information out there that can help people be proactive in their care. Looking up medications, learning the side effects beforehand, can get on the internet and look up issues and be prepared for when they go to the doctor's appointments to ask certain things, to recommend certain tests.
Okay.
Then on the other hand, you get the misinformation, and then it prevents people from doing the right thing, asking the right questions, following up with medication and things of that nature.
Okay.
So yeah.
So almost too much information out there?
Almost too much information.
Okay.
Almost too much information. So that's one of the biggest changes that I've seen in terms of healthcare is the emergence of social media and all this information that's out there. So readily available.
Okay, gotcha. Now, when I was looking through your background, you initially started in medical surgical, is that right?
Yes.
Okay, and then you later transitioned to critical care.
Yes.
What is the difference? What does that mean?
Well, when you work in a medical surgical unit, your patients are not as critical. They're not threatening death at this point.
Okay.
So their care is really at a lower pace. With ICU, you're actually dealing with patients that are just actually on the brink of death. They're requiring a higher skill, more nursing time, more highly advanced medication tests and monitoring.
Okay. Gotcha. All right. So, was it a challenge for you to make that transition, or was that something that you wanted to do, or is it like a natural progression? This is the next stage in my nursing career.
Yeah, it was a challenge because it required a lot of more training. Because a lot of the drugs require different type of calculations, different type of monitoring,
Okay.
and then sometimes you require, you have to get certification for different skills. So it was challenging, but I just really, really, really wanted to be that type of nurse that was there, like really, truly saving lives. So I was
Okay.
drawn to it.
Okay.
Mhm.
That's great. All right. Now, I'm going to kind of take us off track a little bit. Okay. 32 years. You've worked with all kinds of individuals. You've seen all kinds of things. I'm just thinking about in terms of my own career, and I haven't done anything for that amount of time. But we've all had experience with just boneheaded coworkers, right? Just total lunkheads, right? During your career, have you ever worked with someone and just looked at them and thought to yourself, how in the world did you even make it through a nursing program?
Well, I mean, they probably looked at me and asked. I think more so the question was to me more so, but yeah, I mean, yeah, especially when you're in a profession where you are the minority.
Okay.
And
now, when you say in the minority, are you talking about gender? Are you talking about race?
Race.
Okay.
Race.
All right.
So a lot of times, that perception of, if that perception of, well, this person may be more qualified just based upon appearance, just based upon race. So there's been times that I was thrown back like, wow, how did you pass a class? Because you're not really that smart, So there's been some times that has happened. But more so being a minority, that has been the attitude towards me, in which I felt like that I had to prove all the time.
Now, see, that's interesting to me, and it's also disheartening to me at the same time, because you would think in a field like when you're talking about medical care and treating people and saving lives, I don't care if you're purple. If you can do the job and treat me and take care of me and get me to a point where I'm no longer at death's door, why should that matter? And that not just from a patient's perspective, but from, an attending physician's perspective as well. I want the best staff around me so that I can do what I need to do to get these patients healthy again.
Yeah, that's true, but unfortunately, that's not our reality. A lot of my coworker and peers, they kind of tease me because I always pronounce my full name and I always put the RN. So it's always Dena Mayes RN. And that is because and even now, I never ever, upon meeting a patient, I could come in and do my whole introduction and I'm still confused with housekeeping, dietary, the unit secretary, things of that nature. That's just the way it is. It's a lot better now because a lot of healthcare systems are using the ID with the big RN because that had been an issue for many years, right? Mistaken staff and things of that nature. So yeah, sometimes you will want the best care, and that's what initially most hospitals promote. They want to promote the best workers, and normally they do, but sometimes people still have those preconceived ideologies about a certain person based upon how they look.
Wow. Okay. That's eye-opening. I appreciate you sharing that experience.
Yeah.
So let's go back to 2020. And I know nobody wants to go back to 2020,
Okay.
but we're going to take a step back and look at last year. So last year, the pandemic hits. And this is an environment we're seeing things, experiencing things that no one has really lived through before, right? How did that impact the state of nursing in terms of policies and procedures and best practices and patient care? How did that affect what you do and what you started to see and experience within the healthcare field?
Well, yeah, I mean, this COVID it really flipped healthcare because one of the things that it did was it prevented visitors. I mean, they immediately stopped visitation. I mean, you could not get in.
Yeah.
Screening before you get in, the type of equipment that we're requiring to use now, the N95 mask, and the fact that you have to have a mask on throughout your shift. Not so much the N95, but you have to wear a mask, even when you're just charting or rounding. In every situation, you have to wear a mask now. That was not the case.
Yeah.
Hand washing had been a big deal throughout the history of nursing and medical management. Hand washing.
Okay.
But now with the new COVID, they're restructuring hospitals, restructuring the way social distancing. Even the break rooms have the plexiglass at the table,
okay. Yeah.
and you only can have 2 or 3 in the break room at that time. So it's really changing how we actually live, and I think these standards are going to be here to stay.
Wow.
Yeah.
Wow. So no end to that. So you're thinking that a lot of these policies and procedures are in place now are going to be there for the long haul?
I think so. Absolutely.
Okay.
I think so.
And what about visitation? Now, you mentioned a key factor. Hopefully you caught that. One of the first things to go was visitation. And in my opinion, I've had elderly family members that have been hospitalized and that sort of thing. And one of the biggest pick-me-ups for them was to have family members come in. They're seeing the grandkids, they're seeing their children and that sort of thing, and that lifts their spirits. Because, no offense, but the hospital can kind of be a cold, lonely place, right? So to help with that mental aspect of your care, to have that taken away, that's got to be really significant. I mean, I just can't imagine what it would be like to be in a hospital and in really poor condition, and I can't see any of my loved ones. That's got to be something that's got to be a huge struggle and a huge challenge in terms of just improving the overall health of someone. So you think that policy is going to stay in place?
I know that a lot of hospitals are really trying to implement visitation, and they have. They're actually kind of reducing the amount of visitors to where you have one visitor for that day. So they are finding that a lot of patients are, recovering when they have that person that can be that's right there next to them, their loved one.
Yeah.
I found that was one of the hardest parts of working with COVID patients is dealing with the family members, to pick up that phone and have a daughter crying, because they have not seen their mom. And that is one of the hardest parts of handling COVID. It takes a toll on you mentally when you have someone saying, can you tell my mom I love her? Can you please take care of my mom? Don't let my mom die, and things of that nature. This is the reality.
Wow.
And that to me has been the hardest part.
Yeah, I can see why it would be.
Yes, and the calls are constant, and you don't want to ignore them. You want to return every call.
Yeah.
Because I can imagine.
Yeah.
Yeah.
So one of the one of the primary driving factors that I looked at when I really wanted to have you on the show is your direct experience as, and what you've been talking to this about to this point have just been regular experiences at the hospital that you work at. You recently spent some time as a COVID ICU nurse.
Yes.
So you were really at the front of the front lines when fighting this virus. What was that like? What effect did it have on you? What did you see? I mean, because most of us don't, obviously, we're not allowed in hospitals unless you're actually admitted. So we don't see that. We just hear about what we learn from the news and reports and that sort of thing. But you saw it. What's it like being in the middle of an ICU ward that is dedicated specifically to individuals that are afflicted with COVID-19?
I'm gonna tell you, it's overwhelming. One of my first thoughts in dealing with this, because this is a different type of ICU. Even though I had a lot of experience with ICU, this COVID thing was new to me because the standard of care, the different type of medications and interventions was much more different than what I was used to. So that was a lot of learning. I learned a lot in regards to this care for COVID, that patients that are really, really deathly ill. But one of the first things that I thought was, I felt that if the public had privy to COVID up front, I think the numbers would have dropped drastically.
Really? Now elaborate on that. What do you mean by that?
Because I think if people saw it, because you really don't know how bad it is until you see it.
I can believe that.
And I think, because there's a lot of people out there that's still saying, oh, it's just like the flu, or it's propaganda, or it's a conspiracy. It's not really real.
Politically motivated.
Absolutely. But if the lay person can actually stand by and see this thing, I think a lot of people wouldn't have a problem putting their mask on, social distancing, washing their hands. I think the numbers would have dropped drastically if people could have seen it, because it's not pretty at all, and it is taking people out of here at a rapid rate. And when you see nurses on TV saying that it's affecting them mentally, oh, it's real, because it's an ugly bug. It really is.
Wow.
Yeah.
So where you were working, were there high numbers of individuals that had to be intubated, and what did that situation look like?
Yeah. I would rather have worked with patients that were already intubated than to work with somebody who is struggling to breathe, because there's only so much you can do before intubation. And the reality is, once you get intubated, it's a big stretch of surviving.
I'm sorry. Intubation, basically a breathing tube is inserted into the patient's throat, correct?
Right, to help breathing.
Okay.
And a lot of times, especially people with the comorbid conditions, the obesity, the diabetes, and things of that nature, once they get on that machine, it is really hard to get them off, and really, really, really hard for them to really survive and kick this thing. So, one of the things is trying to get people to be healthy, so that if they are afflicted with the virus, that they can, do things on their own to help prevent, the catastrophic respiratory ailments that come with the virus.
Okay. Did that affect your being in that kind of a setting on a regular basis? Did that affect personal relationships with family members and that sort of thing? Did that cause any stress? Because you're already dealing with stress being in that environment. Were family members kind of, lack of a better term, where they're freaked out? My mom's right in the middle of it. My child's right in the middle of it. That sort of thing.
Yeah, my children were very concerned.
Yeah.
Regarding that. I had family members saying, no, don't do it. But one of the things with COVID is it's a virus, like other viruses, that if you take precautions, the likelihood of you contracting it is not that great.
Okay.
So if I'm dealing with someone who I know have the virus,
Yeah.
and I'm taking the precautions, then I'm not really, 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 really too concerned about that at that particular time. It is the public that puts the scare in me, because it's the public that's not really doing what needs to be done. I've witnessed people with masks on in public take the mask off to cough and then put the mask back on.
Oh, you gotta be kidding me.
So,
Oh, man.
working with COVID, you know that you're dealing with COVID patients. So you could put your N95 mask on, you could put your face shield on, you could put your gowns on, you could hand wash, you could sterilize and things of that nature, and pretty much feel comfortable knowing that you have really taken all the precautions to prevent transferring this virus into your body.
Okay. Did the safety precautions change from being in a typical hospital setting, in the middle of the pandemic, and what you had to do as an ICU COVID nurse?
Well,
or the pretty the same?
With COVID, it is really a special, it's a droplet precaution, meaning that you have to wear the special type of mask, and then you're doing a hair covering, and you're doing the gown and the gloving, because the virus can live on surfaces for a certain amount of time. And so you do want to protect yourself. These precautions were in place before COVID. Now, one thing I want to say is I hear a lot of people saying, oh, we've never seen anything like this before. We've never had this. That's not true.
Okay.
We have had this before. It's just that, not to downplay COVID, it's just that it's out here now. We have a lot of social media. We have a lot of ways to getting this out in the news coverage every day with the numbers and accounts. But we've been here before.
Are you referring to like SARS?
Yeah, we've had the H1N1.
Okay.
We also had another virus that everyone should be
swine flu.
With.
I remember that.
Swine flu, and let's not forget the AIDS epidemic.
Absolutely, that's right.
Everybody to this day knows somebody who have had HIV or has succumbed to HIV.
Mm-hmm.
Okay, so that epidemic changed the way we do things as well. So we've been here before in terms of dealing with these contagious viruses and bacteria and things like that. And it's basically the same thing. These measure hand washing. Yeah.
Mm-hmm. Now, it's no secret. I mean, this show is about health and wellness and fitness. And I understand, no one is immune to the virus. But whether an individual is athletic and lean or obese and sedentary, if you had to guess at the number of individuals that you saw in this COVID ICU unit, we know that is a contributing factor to taking on more of the negative side effects of the disease. Could you throw a percentage on the individuals that were in there that were overweight or obese, if you just had to guess at it? Or was it pretty evenly dispersed?
Okay, the ICUs, now I did 2 ICUs and then I did an ER. So for the most part, many of them were obese.
Greater than 60%?
Yeah. Yeah.
Okay. So the data.
I don't have any stats on that.
I got you.
This is just I'm just recalling my experience, so I don't want anybody to check me.
Gotcha.
But because
Yeah, and I was just looking for a guess. If you had to throw a number at it, what would you say?
I want to say maybe all of them.
Wow. So the data basically holds true, because that reinforces what you just said and what you saw. Individuals that tend to be overweight and obese. So that's just more of a reason to do what needs to be done to, manage your weight and eat properly and get the right amount of sleep and manage your stress and those sorts of things. All the topics that we support and promote on this show. So I just wanted to have that information shared firsthand from someone who's not just getting the information from a newspaper article or a magazine or a TV show or news report. She's been there, done that. She's seen it firsthand.
Okay, so can I clarify? Not even though you may be lean and healthy, because I worked in the ER section as well, where I had people come in physically fit and caught it, and they were sick. Like sick to the point of, I'll never forget the guy that came in. He had to be at least 6'4", 6'5", and he came in, and this man had a fear in his eyes that I had never seen before. And he was like, I'm scared. I've never been this sick before in my life. Wow. So this virus, you can contract it whether you are healthy,
right,
with no pre-existing conditions. That's the thing about it. And just because you don't end up in ICU, you still can become pretty sick.
Wow.
So it's just a matter of making sure. One of the things the public don't understand is about a lot of habits that we really need to try to make natural. And I see that the wearing a mask, a lot of people get a false sense of reality about, if I wear the mask, I'm going to be okay.
Right.
But if you wear the mask, you will be even more safer if you still continue to social distance.
Okay.
And then wash your hands.
So you're thinking, though, because that actually leads into the next question I have for you. I was going to ask you what additional steps we, the general public, can take to prevent or to minimize the chance of contracting the virus. So are those your two big factors, social distancing?
My biggest factor is the mask.
Mask, okay, number one.
And then just because you have the mask on, you still should not have that comfort in coming up close to people, because a lot of times these masks, they're not the type of mask that prevents the particles from crossing through. The mask is essentially the same thing as covering your mouth when you cough.
Okay, because the masks that are generally available at Target and Walmart, they're not like medical grade masks.
Right, okay. Right. So say you have a mask on and you walk up to somebody, the sales lady who's not social distancing, and she's talking, and particles come out of her mouth and come through the mask, which can happen depending upon what kind of mask, and then it transfers onto your mask. Okay.
Okay.
And you take your mask off.
Yeah.
And you touch it. Okay. You touch the outer portion of your mask.
I got particles on my hand.
You put it down.
Okay.
And then scratch your nose or pick up a cheeseburger.
Okay. Yeah.
You have just introduced that virus into your body, but you wore a mask.
Right.
You did what was needed.
Right.
And that's what I always tell people, especially my children. You wear your mask, you social distance, and before you touch your face, scratch your nose, rub your eye, eat anything. I see a lot of people eating in cars, and I'm like, oh my God, I wonder if they wash their hands, because the virus can live on surfaces. I'm not sure how long, but it can live on surfaces. And you just want to make sure that you are washing your hands in addition to the masking and the social distancing.
Okay. All right. So you heard it here, folks, straight from a registered nurse that spent time in a COVID ICU unit. We've been hearing a lot of information on the news about the vaccination, the vaccinations that are available now. Depending on what group you're in and that sort of thing, but we know that they exist. We know that they're out there. I know that there's varying levels of effectiveness and that sort of thing. And it was also our social media question of the week, and I know you heard that.
Okay.
So if someone were to come up to you and Nurse Mayes, I'm on the fence about getting this vaccination. Should I, shouldn't I? What are your thoughts on that? How would you respond to that person?
Unhesitate. Yes, get it.
You would.
But I will not participate in a debate with someone.
Okay.
This is how we have always overcome these type of epidemics. We vaccinate.
Yeah.
And we promote preventative measures.
Okay.
Because COVID-19 will not be the last one. So,
I got you.
And with the use of all the antibacterial soap and the hand sanitizer, whatever comes after COVID is going to be
Stronger.
even more aggressive.
Because it's had to deal with that and adapt and adjust and
absolutely,
yeah.
Absolutely. Okay. Even before COVID and this and that, I always say treat every surface like it's contaminated.
Wow.
When I go to the movie theaters or anything like that, I've never touched public surfaces. If I do, I'm washing my hands afterwards. Hand sanitizing is good.
Yeah.
It's good. But when you're washing your hands, you're literally promoting friction in that running water to wash those germs off your hands.
Okay.
So, yeah, it's very, very important to know that just because COVID-19 has been so highlighted, that this is not the only bug out there. This is not the only virus that you still can contract and get and make yourself ill.
Okay. Okay.
Thanks
for sharing that.
Okay.
Last question. Just in case we have some viewers or some listeners that are out there that, maybe they're aspiring to have a career in nursing. Can you offer any advice to someone that, how do they get started? What should they focus on? What can they expect? What preparations can they take in order to get started in a field like that? Because it seems like it's very rewarding, very challenging, but very rewarding at the same time.
Well, because I've been in the game for a long time, I wouldn't know how to advise a person at the time because it has changed. Because now courses are online. Sometimes you don't even have to go up to the university and things of that nature. I would just recommend them contacting a local community college or university and talk to an advisor to find the necessary steps to get started.
Okay. Okay. All right.
But I would tell them, please don't do it for the money. You have to care.
I think that's really the underlying message to that. You gotta care about people. I mean, honestly, do you really want someone treating you that's just in it for the money?
Absolutely. You can be the smartest nurse in the hospital, but if you don't care, it doesn't even matter.
Wow.
So I would recommend that if you really have a true passion for caring for people, then go ahead and do it. Don't do it for the money.
Okay. All right. Well, Nurse Mayes, thank you so much for joining us today. Really appreciate it and all the information. If you wouldn't mind staying here, we're just going to wrap up the show. Just got a couple things that we want to address. And I hope you all enjoyed that information and that interview and her being so transparent with the state of nursing and what it's like being in an environment where we're living in a pandemic. So really appreciate that and very glad to have her as a guest on the Vanguard Fitness Hour. So just a couple things left, a couple housekeeping items that we need to get to. Our fitness tip of the week, and that is to de-compound the problem. So what do I mean by that? If you're overweight, if you have diabetes, if you eat fast food regularly, if you drink a soda a day, if you lead a sedentary lifestyle, why in the world would you want to take up smoking? You're just exacerbating the problem. So my advice or our tip of the week is to start by removing just one detrimental factor from the equation. Focus on that, and then you can build upon it. So don't make the problem worse. Try to do things to alleviate the situation so that you can stand a better chance of achieving that optimal level of health. So again, that Vanguard fitness tip of the week is to de-compound the problem. Just focus on one negative factor that you can improve or remove from your everyday lifestyle. Having said that, we have concluded or wrapped up season 1 of the Vanguard Fitness Hour. And it has been fantastic. We've gone through 10 episodes. We're going to go on a brief hiatus. We're going to retool new topics, improve visuals and audio, new guests. New guests and returning guests, more strategies that you can use to, become the best version of yourself. So looking forward to season 2. We got some exciting things coming down that I'm going to be sharing with you. And that next show, the start of season 2, will begin on Friday, March 19th of 2021 with episode number 11. So having said that, it is time for us to wrap up the show. Again, thank you for being here. Thank you for tuning in. If you're a regular viewer, thank you so much. Looking forward to having you back. And we're looking forward to continuing to bring the most accurate, up-to-date, and helpful health, wellness, and fitness information possible. So until next time, remember the Vanguard motto: train hard, eat clean, and stay focused. We'll see you next time. Take care, stay healthy, and again, we're looking forward to seeing you for next season 2, coming up in 3 weeks. Remember, mark that date down, Friday, March 19th, 2021. Super producer Koonce, anything to wrap up the show with?
It's the Vanguard Fitness Hour, people. I am the super producer. Koonce, the super producer. Miss Mayes, thank you so much for all of that information. Thank you so much for all of that information. Great information. Great. But as Mario said, yes, we will be beginning our season 2, March 19th at 11 o'clock. So these last 3 weeks right here, what we're going to do is, as you said, take a break. And not really a break, just really put some things together. We got a lot of exciting things happening. Spring is actually coming in, so this is a good time for, you guys to get ready for some of the things Mario is going to be doing outside, his studio. So, and guess what? I'll be there. I have to be
Looking
there.
Forward to it.
I can't be in my studio. But no, definitely we appreciate you guys so much, and thank you very much for watching the Vanguard Fitness Hour with WDHR Radio Digital Broadcasting Network. You guys have a safe one. Always mask up, 6 feet apart. Peace.
Right.
I'm out.
Take care, everybody. And then that live.